My name is Sarah Laber, and I am an MSN student at Eastern Kentucky University. This is a presentation on an evidence-based project proposal. The clinical nursing problem identified is depression, specifically in adults ages 18 years and older. Depression is a debilitating condition that affects 350 million people worldwide. In the United States alone, in the primary care setting, depression is diagnosed in 5 to 13% of patients. However, about 50% of primary care patients with depression are underdiagnosed or simply undiagnosed. Depression does not discriminate against sex or age. According to the National Health and Nutrition Examination Survey, 7.6% of Americans who were 12 and older had depression, with an increase in prevalence in females and individuals living below the poverty level. The Office of Disease Prevention and Health Promotion has established a goal in a Healthy People 2020 that includes the increase in depression screening by 10% for primary care providers in adults ages 19 and older. With approximately 19% of adults experiencing depression, it is imperative that primary health care providers and advanced practice nurses recognize and treat this disorder. Depression affects so many facets of life. For the advanced practice nurse to focus on adults ages 18 years and older, it could potentially change the lives of those suffering from this debilitating condition. Depression in adults is a common psychiatric disorder. Despite a usual course of treatment with medications such as antidepressants, sometimes depression is not successfully treated and becomes a chronic condition. The purpose of this proposal is to implement an evidence-based intervention to explore mindful-based cognitive therapy, or MBCT, and the effects it has on adults diagnosed with depression. MBCT has been developed by incorporating mindful-based interventions as a course of treatment in fighting depression. Mindfulness can be described as a non-judgmental awareness of the present moment and includes exercises such as meditation. MBCT strengthens cognitive control of emotional regulation. There were 4 randomized controlled trials that analyzed MBCT and the effects it had on patients. Eisendrath discovered that MBCT significantly lowered depression scores compared to other treatment groups. Alderin observed that groups in the MBCT sessions reported less depressive symptoms than treatment as usual alone. Potts revealed that the MBCT group sessions showed significant reduction in overall depressive symptoms compared to the control group. Gershwind proved that MBCT sessions were in fact successful compared to the waiting list control group and reduced depressive symptoms by 35%. The information and outcomes of these 4 studies for nursing practice is invaluable. MBCT is an alternative treatment to consider in conjunction with other modalities for depression. These studies both assist in providing more information about MBCT and supply patients with an enhanced understanding of how MBCT works. MBCT appears to have definitive effects that make it a useful treatment for patients with depression, especially because patients are interested in learning about non-pharmacological approaches. The method at which this proposal will be carried out starts with approximately 50 individuals. They will be verbally recruited by the APN from a primary care clinic in Richmond, Kentucky, and asked to participate. The participants will be recruited based on the diagnosis of depression by the nurse and at least 2 depressive episodes within the last 2 years. Phase 1 starts with the self-assessment and orientation. Participants will meet at the John Rowlett Building on the campus of Eastern Kentucky University. During this time, the framework of the project will be explained to all participants. The individuals will each get an opportunity to sign informed consent, and after this is complete, the participants will each begin the self-assessment evaluation tool called the Center for Epidemiologic Studies Depression Scale, also known as the CSDR, and that's in written form. And then the Hamilton Depression Rating Scale, also known as the HAM-D, will be performed as well. Phase 2 begins with the MBCT sessions. The first session will be the same day as orientation, and the participants will begin once a week group sessions with the focus being on meditation, exercises, cognitive behavior techniques and patterns, and each group will last 1 hour and will meet weekly for 16 weeks. During Phase 3, the final stage of the study at 16 weeks, the HAM-D and the CSDR will be again subjected to the participants. Phase 4 consists of all participants being assessed again using the CSDR and the HAM-D at 6 months and again at 1 year. and this will provide follow-up and evaluation if any long-term effects of MBCT are effective. The purpose of this project is to implement MBCT to meet the following objectives: to assess whether MBCT actually lowers depression, and to explore the effect MBCT has against depression. The outcomes of the proposal will be measured by the CESDR and the HAM-D. The CESDR will provide knowledge to research from participant self-report and will measure depressive symptom severity. The questionnaire consists of 20 questions and includes 9 different groups of depression as defined by the American Psychiatric Association Diagnostic and Statistical Manual. It asks the participant depressive symptoms described as rarely, some of the time, or little of the time, occasionally or moderate amount, or most or all of the time. The CESDR will be helpful with the intent that it will promote more in-depth responses and decrease researcher interference. The HAM-D is to be administered by healthcare professionals and measures the severity of depression as well. The benefit of the HAM-D is it is a useful tool in the guidance of recovery of depression. The HAM-D is a 21-item form and is scored upon a 3 to 5 point scale for each question. A low score indicates low depression, whereas a high score indicates severe depression. A reduction in the CESDR and HAM-D scores will indicate a successful outcome. The implication of this proposal is aimed at reducing depression. This evidence-based intervention is expected to establish MBCT sessions into routine depression care. Depression is a devastating disease that can destroy all facets of life and unfortunately plagues much of the population. It is, however, a disease that can be quite manageable if treated properly. The emerging evidence included in this poster demonstrates how MBCT can transform current depression treatment into a new standard of care. Thank you.